We okay?
I think so.
All right. We're having some little bit of technical difficulties here on our first one. So, in any case, my name is Dr. Elliot Hirschman again, and we're at New Life Functional Neurology and Endocrinology in Greenville, South Carolina. And we help patients that have chronic ongoing health conditions that are not getting the answers and, more importantly, the solutions to their health issues from the traditional medical system. So, back to the diabetes diet and how it might be making your diabetes worse. So, likely if you have diabetes, type 1 or type 2, you've been recommended a diabetes diet by your doctor. But what's happening is it's more important, there are other things that are more important than just measuring grams of carbohydrates and grams of sugar. And the reason why is because, as you might be aware, type 1 diabetes is an autoimmune disorder where your immune system is actually attacking your pancreas. Well, for 25% of people that have type 2 diabetes, the same thing is also true. Your immune system, instead of just worrying about the bad guys like viruses and bacteria, is also having an impact on your pancreas, which is supposed to be producing insulin that helps to regulate your blood sugar. And so what happens is there are certain things in your diet that can actually trigger and make worse that autoimmune attack on your pancreas. One of the two biggest things are gluten and dairy. And so those things are making your immune system attack your pancreas even more, and therefore you're not able to produce the insulin that you need to help balance and regulate your blood sugar. So people with type 2 diabetes in particular can go for a long time and may never even know that they have this autoimmune component. But what it's called is type 1.5 diabetes, or 1.5 diabetes, also known as latent autoimmune diabetes of adulthood. And so there's lifestyle components that are associated with it, just like regular type 2 diabetes. Diet and nutrition play a huge role, but also the immune system plays a role in this when you have this latent autoimmune diabetes of adulthood. And so it's not just enough to count the calories and count the sugar and the carbs. You also have to look to see whether or not these foods are having an immune reaction when you're eating them. So certain foods have been linked to autoimmune diabetes, the gluten and the dairy, as we talked about. And what happens is if you're eating these foods and you're creating an immune reaction to them when you're eating, it's like having underlying inflammation all the time, and it's driving that attack on your pancreas, preventing you from producing insulin appropriately to help manage your blood sugar. And you may have a sensitivity to a food like gluten or dairy and not even have any gastrointestinal complaints, so you may not make that connection without doing testing or some sort of an elimination type of diet. So again, the top two foods to avoid are gluten and dairy. Gluten in particular has been shown to trigger an autoimmune attack on an enzyme called GAD, and that GAD enzyme has an impact on insulin regulation and even brain function, in particular your cerebellum, which coordinates balance, or is responsible for balance and coordination. And then casein, which is in the dairy, that's the protein in the dairy, has also been linked to autoimmune diabetes as well. So you're not going to really know whether or not you're sensitive to gluten or dairy or potentially another food and what impact it's having on your diabetes unless you do